On to our next speaker, Dr. Nipunika Senadheera. She is a doctor practitioner with an extensive background in hematology, both locally and internationally. She currently leads the bone marrow transplant team at Lady Ridgeway Hospital and has recently completed their first bone marrow transplant. She has a diploma in pathology and completed her medical doctorate in hematology at the Postgraduate Institute, University of Colombo. But without further ado, I'd like to invite Dr. Nipunika to the floor. Good evening, Doctor.
Good evening, Sasha. Thank you very much. And first of all, I would like to thank the Unity Mission Trust and especially my dear friends Shamala and Bertel for inviting me to talk to you, young ladies, on this Women's International Day. It's indeed a pleasure and an honor to be with you today. Although I have never been able to contribute to your work, I have followed your newsletters and really admire the work that you do and your dedication. This type of work is very close to my heart as well. I was wondering what to say to you on this occasion when I was invited to speak to you. When I expressed this, Bertel, he said, just talk about yourself. So that's what I'm going to do. But let me give you one advice. You may learn from other people's successes and failures, but you must always build your own identity. My latest achievement, as Sasha also mentioned, and if I may say so, is establishing the bone marrow transplant service at the Lady Ridgeway Hospital for Children. Bone marrow transplant is the only cure for some diseases, especially those you are born with, like thalassemia. It was, of course, a teamwork, and we have successfully completed the first bone marrow transplant in our unit. This is the very first one to be done on a child in a government hospital in Sri Lanka. So our first patient was a 7-year-old girl who had thalassemia, needing blood transfusions every 3 weeks to survive. Now she can live a life free of transfusions, and the transplant has given her a new life. So I'd like to share with you today my experience in building up this unit. Going back 5 years, in 2017, when I was appointed to LRH, that is the Lady Ridgeway Hospital, as a consultant hematologist, bone marrow transplant, there was no transplant unit, and I was the only staff member of that non-existing unit. After working in several hospitals around the country, this was the biggest challenge I faced in my career. 5 years from that, today, we are a team of 2 consultants, 7 nurses, 4 doctors, and 3 supporting staff members, and with a state-of-the-art bone marrow transplant unit with all necessary facilities, and another 12-bed unit coming up in the hospital for us. In that 5-year journey, there were so many disappointments, frustrating moments, and deadlock situations. I had to convince people of the necessity of this unit, how it will help needy children who had no other option, who don't have 8 to 10 million rupees to do it elsewhere. I had to find staff, arrange their training, get equipment, and even supervise the construction of the building. But with time, my team became involved in the work, and then they took the baton. So along the way, I met wonderful people who supported us, our mission, and helped selflessly. The lesson I learned is that when you're convinced of what you're doing and focused and committed to your work, people gather around you and support you. As a woman, while attending to all these work commitments, we all have to play the role of wife, mother, and daughter. These carry a lot of responsibilities. I am blessed with a lot of family support, but even then, it was exhausting at times. However, my experience with it, I think women have the ability to play all these roles simultaneously. The ability to multitask, which is quite unique. I see women doing this all the time, but wonder if they realize this and its uniqueness. We must also, and I strongly believe that women have a lot of unexplored capabilities within themselves. All you young ladies, you must explore your strengths, know your weaknesses, and in short, understand yourself first. Then you can face life with your full potential. We must also, at the same time, learn to live our life. Mere existence would not do. So try to enjoy what you do while you do it. Don't wait till the end to enjoy it. Enjoy the process, not only the end result. And always try to associate with people with positive attitudes and with whom you can have a good laugh and who would brighten your day. So that's my short message to you. With that, I will stop. Wishing all you young ladies more strength to carry out the good work you do through Unity Mission Trust, and also wish you all the very best for all future endeavors. Thank you.